All right, well, it looks like we're pretty consistent here with the members in the room, so we'll go ahead and get started. But like I said, welcome to February session of Office Hours. We'll be covering a back to basics session today, so inbound referrals. With that question that I kind of had prompted earlier, it's hard to gain hours back in your busy work days, but being able to use automated referrals, Luma may be able to give you some of that precious time back for sleeping, reading, eating, whatever it may be. With today's session, as always, it will be recorded. So we'll go ahead and share this with all of you in attendance, and you can kind of socialize it amongst your staff members if you would like to share. We'll hold some minutes towards the end for a Q&A session where our guests that we have with us, Dawn and Arthur and myself, will help answer any questions you have about the content today. But we can jump right into our presenters. So we have Arthur, who's our customer success manager, and we also have Dawn here, who is our product training manager. So if you guys would like to do a quick little intro, and we can jump into the content.
Absolutely. So thank you all, everyone, for joining us, whether you're here live or you're catching this on the replay. Arthur and I have decided to kind of do a tag team to talk about inbound referrals today, because not only do we refer to inbound referrals as just that, inbound referrals, we also can do something with it called outreach. And Arthur has a deeper dive into taking a look at this that he'll do sort of the second half of our session today. So kind of road mapping where we're headed. We're going to introduce you, first of all, to what inbound referrals are. We'll look a little bit at how to set them up. We'll look at the differences then between referrals and outreach. And lastly, we'll provide you with some resources. We always want to make sure that you are well ready to head out there and be able to utilize all of these tools here at Luma. So I love to utilize polls. If you've had the opportunity to do live training with myself or with Carla, you know that we love to make these an interactive type of situation. So my question for you, first of all, is I want you to imagine that there's a business that you like to frequent or you like to patronize. And my question for you, and as soon as I get to the right poll, there we go, I'll launch it out. What is the best way for them to be able to reach out to you? And you'll see that poll popping up on your screen. The options you have are text, letter, phone call, email, and carrier pigeon. Give you a few minutes to weigh in on this one. No one's picking carrier pigeon. They never do. As a virtual trainer, this is the few laughs that I do get. So thank you guys for hanging out with me. All right, let's see how we did. We got quite a few of our folks participating in this one. So we're going to share this out. And it looks like, as I suspected, the vast majority of you are saying text is the easiest way to be able to reach out to you. And that's actually something that is true in healthcare as well as in other realms of organizations and businesses that we may interact with. In fact, this really holds true with what we see here at Luma and also what we see in the rest of the world as far as what texting is. So we see about 40% higher conversion rate for those that are contacted via text than those that are contacted via a voice call. And like you all just demonstrated for us, most adults, about 75% of them, like to receive text rather than calls from businesses and other services. And we see this, we live in an era now of those non-obtrusive messages. We are more likely to respond to an email that was sent from a business than we are to pick up a phone number that's one that we don't recognize. So why do this automation? Why automate referrals? Well, one thing, I can't give you that extra hour in your day, but this can give you a way to increase consistency, automatically send those referral requests in sequence. We also can easily keep track of patients in each stage in the referral cycle. And what all this is that when a patient has been recommended or referred to come to your practice, we can have this be an automated process to be able to reach out to those patients and try to get them scheduled to come in and see a provider. So with those inbound referrals, we automatically send those patients reminders to schedule the appointment. So it takes it out of your hands from having to manually go through and do that. Now, when you are working inside of referrals, there's a bunch of different statuses that you'll see. I'm going to put them all up here on the screen just so you can get an idea of the granularity that you really have with Luma's ability to show you different statuses, different ways that patients are represented inside of the product. And I'll put a link to a Help Center article into the chat so you can check out that a little bit later. Big ones that you'll see here: active, that means that Luma is actively reaching out to this patient. Called is a status that we're able to mark once that patient has clicked on the link. If they're being reached out via SMS, we can log that that patient actually has called back in. And then some of the other statuses that you see there, they have some different usages, but again, I give you that Help Center article so we don't spend a lot of time looking into those today. But it is a nice way for you to be able to see the different statuses. And you also, I have a slide that'll show you this later, you have the ability to filter based on those statuses too, so you can take a look. So there are two ways to be able to add a referral into Luma. They are via a link. So this would be sending another provider a link. And then we also can do adding manually for us. So for a lot of you, maybe you're getting referrals that come in via fax and you may have to hand enter them, but I give you now two ways to be able to enter referrals. Hopefully can save you some time. So the first one is sending out a referral link. So with this, you give this to providers who might send patients your way. And I've seen lots of different ways that organizations have used this. Some have, posted it right up on their website so that they're able to share this out with other providers who may be sending patients their way. Others have sent out mailers and used QR codes and done email campaigns behind it. But with a link, there is a two-step process. First is to send that link out to your referring provider. And then just to give you some visibility into how these are coming in, you do have to then go in and approve the patient. So to give you a look at what this looks like, once that link is clicked, this is the screen that your referring provider would have. So rather than having those providers fax things to you, you can provide them with this link and they can go ahead and fill this out. It is very handy, walks them through the process. They're able to look up themselves, or if it's a staff member adding this in, they can look up the provider with the NPI registry. They also then have the ability to enter up to 5 different patients all at the same time on this form. So very handy to have this come in. Oh, and one more note there, my click notice there. So if a provider is not showing up in that registry, you do have the ability to add them in there too. So if you happen to not see them there, you can add them in. So what's this look like then for you? Well, if you are familiar with the activity feed inside of Luma, this is what a referral sent in via a link would look like. So you would have a notification that you have a referral that was sent in, and you're able to then click on the box to go over and review it. Once you're inside of there, you can click on the 3 dot, or what we sometimes call the kebab menu, to dig into there a little bit deeper. So you can reject it. If this is something that maybe was created in error, you can reject it from there. You'll see the status here right above where my mouse is. It says needs approval. The only time that you will see that status is if a referral was given to you via a link. If you want to go ahead and approve this, you can click on the details, go inside of there. If you have any changes you need to make, you can make them in there, and then you can approve that patient, and then referrals can start going out. And there's my save and approve button. So the other way to be able to add referrals is what we call manually. And this is done on your clinic's side. This isn't something that another clinic or referring physician does. This is for a manual ad. So this might be done if you would receive a fax with a referral, or if someone calls in for referral. And this is just one step because it is being done on your side. So you only have to add that patient to the referral list. To do this, you can do these either singly or in bulk. First, I'll kind of talk about adding them in singly, and that is to go to inbound referrals on the left rail, and then you can click into add your referral from here. Once you're inside of there, there's a lot of spaces that are available to you. There are some that are required, and as you might guess, they're marked with a red asterisk. So you'll have to add in things like the patient name, a way for you to contact them, the referring provider, and so on. Once you are all done with this, biggest thing to remember is do click that save button, because if you click away, it won't save the referral that you have. So I mentioned that there are some required fields that are here. Patient information, of course, marked with that red asterisk. You do have the ability to link this patient up to your EHR if there's someone that might have been seen before. Of course, we need to know the practice information that's in there. And Arthur's going to actually talk a little bit about when these reminders should go out a little bit later. But just know that if you are manually adding, the default start date will be today, and the end of it will just be when that cadence is set to end, because you do have the ability with inbound referrals to decide how frequently and how many scheduling reminders go out. And then, as I mentioned, and I will mention this all the time when I talk about different pieces of Luma, click save to make sure that you do save that piece. Now, one last piece is adding all of the referrals in bulk. So you might have noticed on my screenshot, there was upload a referral, or there was add a referral and then upload. This upload is if you have a lot of referrals to bring in. So if you do that method right above where my cursor is, you'll see that it says our guidelines. This will download for you a CSV file that will show you what you need to have in order to upload that. There are some required fields that are there. Of course, we need first name, last name, date of birth. We need some contact information as well. And I'm going to put into the chat, put into the chat a Help Center article so that you can have access to kind of a walkthrough of how to do those bulk uploads. Like I said, if you do have a lot, this may be a great way for you to go, but if not, you can do them singly as well. So this brings me to our first actual knowledge check. The other one was kind of like an all systems go, all hands on deck sort of thing. So my question for you is this. There are two ways to enter referrals. They are manual add, either single or in bulk. And there was another one that I mentioned as well. I promise this is not meant to trip you up. You guys, my trainer heart is full. You are doing a wonderful job with this. Excellent, excellent. Another few moments if you'd like to play along. And I will tell you too, I say this sometimes during my live trainings, if you would happen to get a question wrong, whether in this session or in other sessions, do know that statistically, you actually learn more from doing things incorrectly the first time than from doing them correctly. So that's a little tip for you. It's all learning. For linking to EHRs, can we find out which ones are supported for that feature? I'm going to delay that question. I'll have the rest of the team get you an answer for that while I carry on and I show you guys the results of your poll. I have to say, I am thoroughly impressed. Every single one of you got this one right. All right, so carrying on our way. Once you start putting in referrals and things like that, the big thing will be monitoring them and seeing what's happening with those referrals. So when we are on that inbound referral screen, we can take a look at the different statuses. And as I mentioned, there are different statuses that correspond with different stages that patient may be in the process. And I also like to point out that there are filters. If you have a lot of referrals that are going on, this can get kind of noisy and there can be a lot going on there and it might be difficult to find things. Of course, you do have the search bar to be able to find that way, but these filters are super helpful because you can filter by provider, appointment type, referral status, and so on. When you are looking at that inbound referrals view, note that you have two different ways to look at this, relaxed and compact. The big difference between is how many of the referrals you're going to see on a screen and also the level of detail that you're able to see there. So with a relaxed view, I'm able to see a lot more information. Specifically, I can see how many times this patient has been reached out to and how many attempts are remaining for them. Also, if you are someone who likes numbers and you like the stories that they can tell, you'll want to know that the reports tab over on the left rail has some information specifically about referrals. And all of these areas in here, you can drill down into them. So you can click into there, see the data that's driving those metrics that are viewable there. All right, so looking into some best practices, a couple of things that we have figured out at Luma with a series of some research that we've done, things that we've looked into. we see that referrals are most likely to result in a scheduled appointment when that reminder is sent, check this out, on a Tuesday or Wednesday morning between 8 and 11 a.m. Kind of some interesting things, I think. We also find that they're most likely to convert if they are sent via an SMS, which is a text message. And also, if you adjust your template to ensure that it includes the provider name, that helps to establish credibility and also make sure that that patient knows where this is coming from as well. So a couple of best practices. We'll have some resources at the end where you can see a few more of our best practices as well. And just like we do some to-dos, here are some to-don'ts to share with you. So we found out that referrals are least effective when we send more than 4 reminders. So, we have that message fatigue that happens. So at that 4 mark, that's really where we see it starting to drop off and be less than effective. Also, if those reminders are sent on the weekend, big reason why is because patients are going to not be able to reach someone over the weekend. And also if those reminders are sent via broadcast. So that is with my piece. I'm going to hand this over to my friend Arthur. Arthur, you should now be able to drive my screen, and I will take my hands off of the wheel so that you are able to drive.
Thank you so much, Dawn, and I hope everyone can hear me okay. Do I see thumbs up? Thank you so much. And I see so many people here joining us today. So I wanted to thank everyone that is here to participate in the office hours with us. And Dawn, I have huge shoes to fill now. She is the product trainer at Luma. I'm just a CSM. So I'll be doing my best to reach Dawn's level here.
Oh gosh, never just a CSM. We all are part of the big team.
Thank you so much. As we mentioned, we're going to be talking a little bit now about the outreach functionality, which is basically the inbound referrals functionality, but renamed, repurposed, I would like to say, to fit certain practices' needs. So I usually like to start by who needs outreach, right? Inbound referrals, we understand that may not be the best functionality or the best use for a lot of practices. I work a lot with FQHCs, primary care providers, family practices, community health centers, pediatrics, and they may be the ones sending those referrals out. They may not be getting tons of referrals, so an inbound referral functionality wouldn't maybe be the best tool, right? But seeing the capability, the power, and the potential of the functionality, Luma decided a couple of years ago to repurpose and allow practices to choose if they want to use it as an inbound referral tool or an outreach tool. So with that in mind, we adjusted and we implemented actually a setting that allows you to change that. And we're going to go over that in the next couple of slides here. But I just wanted to start by showing if you fit this criteria, if you think that the outreach functionality could be a good use for you, and I'm going to explain a little bit how it works, please feel free to reach out to us, contact your customer success manager, and we're more than happy to discuss that with you. So for these ones here, especially at QHCs, we see a lot of them receiving patient attribution lists, right? Patients are attributed to them. They need to connect with the patients. They need to reach out to huge lists of patients that they get just to turn them into actual patients. So those are people, potential patients, prospects that need to become actual patients. With this functionality, I'm going to skip this slide here. You're actually able to do just that. And I'm going to touch a little bit on how you can change this. I see some comments, so I'll let the team. And Rich, thank you so much for providing clarification. Let's discuss this in a little bit if anyone is able to reply in the chat. But for how to change the inbound referrals to an outreach tool. So you can go to your mission control if you're an administrator of your account. Go to the inbound referral settings, and you're going to see a setting called referral. Let me just double check here. The letters are, so referrals, use, outreach, practice, experience, enable. So you just need to enable that setting, and that's going to change the setting, the inbound referral setting, to outreach settings. With that, always remember to save, as Dawn mentioned, just so that the change is put in place. And you're going to be able to see that the inbound referrals language was altered across the Luma platform. One thing that I wanted to mention is that even though this change, you're going to be able to see this change across the account, there will be places that the inbound referral verbiage are still going to be used. So just keep that in mind. Nothing is going to be impacted. The functionality will be the outreach one. It's just that some places, let's say templates and squigglies that you may use in those templates are still going to include the inbound referrals verbiage. Going to move forward. Oh, let me just go back. Perfect. Cool. So again, as I was saying, in some places you're still going to see some referral language here, but this is the view that you're going to have of all the outreaches that you're going to be doing. The flow and the workflow is basically the same as Don mentioned and greatly explained to everyone. You're going to be able to manually add outreaches to your account or have providers using a link. But I would say that I find that more often than not, manual outreaches are done because in those cases, you're not going to have a referring provider. Maybe you're going to have an outreach person doing that through the link. And one thing that I wanted to mention, once again, when you're manually creating that outreach in your Luma account, one thing that I wanted to bring up is that there will be a change from instead of an inbound referring provider, sorry, you're going to have an outreach source. So in those cases, you might ask, what is an outreach source? And that can be anything you want. This is just an example of an account of a practice that I work with. And the way that they decided to do this is creating an outreach and a specific outreach resource in Luma, depending on the type of outreach that they want to do. Let's say they have a future follow-up or a 6-month follow-up that they need patients to schedule an appointment for, right? They got those huge lists from their EHR or for insurance, from their insurance carriers provided to them. They can have that added in a CSV through a CSV file in Luma. And then you can create those outreach sources in Luma as well and have those patients added. Here's just another screenshot of the templates. Let's say you are using the outreach tool. You're going to see outreach templates instead of inbound referrals templates. And at the very top, I know it's a little information heavy here, but for those of you who have already worked in Luma, seeing how those templates are built, you can notice that there are different types of templates in this first white square at the top. And you have future CME needed, and you have all those different types of outreaches listed there. I know this is a lot, for sometimes this can be a lot to customize and difficult to certain people. So if you do not feel comfortable making those changes, please do not hesitate to reach out to us. We're going to be more than happy to help you with that. Our technical team has the tools to make this easier for you. So always feel free to reach out to us. With that, I just wanted to mention one of our partners that has been using the outreach tool of Alexander Valley Healthcare. They've seen great success. They've been able to turn 38% of newly attributed patients into actual patients, right? They made a care appointment. They were able to get connected with Alexander Valley Healthcare. Just being able to close those gaps between patients that otherwise wouldn't be able to get an appointment scheduled and reducing the number of calls that your staff would maybe need to make, calling patients manually to convince them to be seen. You can set a cadence of messages that are going to go out to those patients that are attributed to your practice and get them scheduled. One thing that I wanted to also mention here that I find it's interesting, you can either prompt patients to give you guys a call, or you can also add a scheduler link in that message. So patients are either prompted to call or to self-schedule through an online scheduler, if that's something that you have. And as we get close to the end of the office hours today, I just wanted to mention a few resources, as Don has also mentioned throughout the call, throughout the office hours. We do have some inbound referrals specific resources, all listed over here. This deck will be shared with you all after the call, and you're going to have access to this. These are just a few of maybe the most important resources we'd like to link. There are a bunch of other ones that you can see whenever you click in any of them. You're going to have an option to see others that are related. And some outreach specific resources are also listed here at the bottom. With that, I just wanted to finish with this GIF. I'm a huge GIF fan. Just wanted to see if anyone has any questions. I know it's a lot of information and maybe this functionality, these workflows were not something you had worked with before. Maybe you're just curious to know more about it. I'm customer success manager, so I know I have partners and people that I work with that hadn't had a chance to test this out or to know more about it. And I'm always happy to connect, to discuss, see how we can leverage this functionality that maybe it's already even included in your account and you don't know. So all of my other colleagues, customer success managers, Don, Bryce, everyone is here to help everyone know more about what we have to offer. So love to hear some questions either in the chat or please feel free to unmute yourself and share.
Yeah, and we can start off with Richard's question here, Arthur. It looks like there was some clarification regarding that question. So it looks like Rich said, I'd like to know if ECW cloud users who link Luma referrals to their EHR will have those referrals come into their EHR as direct messages.
Great question, Rich. So this is, and you said ECW cloud, right? Is it the 10E version, 1011?
Yes,
No,
ECW
11E?
cloud.
Cool.
There's
So
no 11, yeah.
11, because I believe there has been some updates going on right now to 12. So I just wanted to check if that was the case too. But yes, let me double check with the implementation managers. I believe that is correct. We are able to pull those referrals directly from ECW. But since there is a different ECW integration, I want to make sure that that's also supported for the cloud one. And I may even be able to give you an answer right in a few minutes if anyone else has any questions while I confirm that.
Yeah, and then it looks like we have another question here from Rob asking, can we pull reports to see the number of referrals appointed or not? And Arthur, I don't know if this is one that you can speak to here as well.
Sorry, let me double check here. Rob's question, can we pull reports to the number of referrals appointed or not? And you mean referrals actually is scheduled, right?
Yep. I went back to the
Yes.
reports screenshot for you, Arthur, if that's helpful to illustrate your point.
Thank you, thank you. Yes, that was, it's a good question. Let me just double check here. I believe, yes, we are, because we are able to track the statuses. And this is something also that I would recommend discussing with your customer success manager because every account is different. So the way Luma is going to track it, that referral is actually scheduled, is if the referral, the appointment that we identify in your EHR is scheduled within a certain threshold. So let's say, and that's customizable. So let's say you want every appointment that is scheduled within 2 weeks of that last referral message being sent. That's going to be linked to the actual referral. Then Luma is going to understand that as being the referral appointment. But let's say the patient schedules something for 3 months from now. Then Luma is going to understand that that may be unrelated, right? So I would recommend checking with your customer success manager just to make sure that that setting is set up correctly in your account. And you can have a way to know, okay, like, are those appointments actually being linked to the actual referral?
Thank you, Arthur. And then it looks like we have another question here from.
Well, I wanted to add one thing to Arthur as well, if I may. So if you have that situation and you don't have it set up to look out, like Arthur said, 3 months out, you can manually change that status to scheduled as well. So if you wanted to just kind of, do some coming up behind and doing a little bit of cleanup there, you do have the ability to manually change it to the status.
Thanks, Don. It looks like Brett has a question here. We're using the referral link to upload because we need the referral attachment to schedule the appointment. The manual and bulk ad do not have the feature to upload referral as an attachment.
That is correct.
And Brett, one follow-up question on that. What are the exact documents that you attach? Do you just attach the actual referral or do you attach anything else? Just out of curiosity.
That's a good follow-up, Arthur. I know I've seen some where they upload like images, test results, things like that. Oh, the actual referral from the primary provider.
Gotcha. Okay. Thank you, Brad.
Mhm.
And Rick, just answering your question about supporting pulling those referrals from ECW Cloud. Yes, we are able to support that. So I would recommend just checking with your CSM, because there are some commands that need to be taken in the back end of Luma to be able to do that. So
Wonderful. Any more questions that we can help answer?
Well, thanks everyone for joining us. I know this was like a high level, like, fast paced look at inbound referrals. It is one of the really cool features of Luma that does have the ability to save tons and tons of time. So if you, like Arthur mentioned, if you have this, haven't set it up yet, we can work with you and get things set up. Or if you want to add this on, we can do that as well. So shall we roll on to what's happening for next month, Bryce?
Yes, please.
This is exciting. I'm excited for this one.
Yeah, this will be a cool one. So next month for the March session, we'll be covering digital call deflection. So this is an early access program feature that we've recently rolled out. It allows you to empower patients, to self-serve by rerouting them when they inbound via phone. So we'll actually have a couple members of our product team to help dive into this a little bit more and see if it's a good fit for your organization. So that is what we kind of have coming next month. That'll be March 23rd. So it'll be on a Thursday again at the same time. So we hope you can join us for that session. I just wanted to say thank you again to Dawn and Arthur for sharing the content today. It's awesome to see the different ways that, we can use inbound referrals or outreach to stretch to different use cases. Thanks for kind of showing us those how-tos and the do's and do nots as well. I hope you all found this beneficial. As always, this will be recorded and sent out, so you can go ahead and share this as needed. And we hope to see you at the next session. Thank you very much.